Is open enrollment about to start at your job? Well, it is at ours. Keep listening to hear our tips on how to get the most out of the benefits at your job. Hello, and welcome to the Wealth Minded MD podcast with your money best friends. I'm Dr. Brittany Halford.
And I'm Dr. Leisha Taylor.
And of course, we're here to help you build wealth and make good money decisions so you can create the life you desire and have more control over your time. Hey, Leisha, one of the most important financial tasks we do as doctors is protect ourselves, which means getting the right insurance. I recall purchasing my insurance policy just a few days before I graduated from residency. What was your experience?
So I got my insurance when I graduated from medical school right before I started residency. I actually called a few agents, but I had the best service from Pradeep Auto at PKA Insurance Group. He was super responsive and personable. Unlike some of the other agents, Pradeep actually got me quotes from all the major companies and actually took the time to explain the nuances in each of their policies. What I love most is that he wasn't just this way for me. Whenever I would send one of my friends to him, he would not only speak to them, but he'd also let them know where to go or who to contact if there were better options or discounts available.
At PKA Insurance Group, Pradeep Auto and Matthew Peterson are independent brokers focusing on disability and life insurance. They excel in securing coverage for physicians and other medical professionals. Discounts on disability insurance can range from 10 to 40% depending on your situation. And there is now an A+ rated carrier offering up to $10 million of life insurance without lapse. If you are very healthy with limited to no medical issues, approval is likely in 5 minutes. Reach out to PKA Insurance to discuss your disability or life insurance needs at www.pkainsurance.com or call 1-800-258-1018.
Leisha, I am super excited for the free masterclasses that we have coming up. Not only because I love meeting with women and chatting with them and teaching them about how to manage their money better, but we're doing a little bit more than that this time. We are actually going to teach women how to not only manage their money, but make more money. More money, more money, more money, more. Me too. We have 2 master classes coming at you that you are not going to want to miss. Did you know that over half of people never negotiate their salary at their job? And did you also know that over 70% of employers would negotiate, but the candidates never asked for it? So we're going to teach you how to negotiate with some confidence, negotiate like a boss, negotiate with success. And we're going to be teaching you that in our first master class on November 12th. And in the next master class, we're going to teach you how to determine which side gig is right for you and how to leverage your 1099 income to do what I love doing best is reducing my expenses. Reducing that tax expense with your 1099 income. And so if you are someone who would really enjoy learning about different side gigs, learning about some of the perks of 1099 income and how you could use that to your advantage, please sign up to attend our masterclass. That one will take place on November 14th at 8 p.m. So if you are interested in boosting your income at your job and outside of your job, then you definitely want to be in the building. Not only that, you will get access to our exclusive guides that are going to teach you the exact steps that you need to know how to negotiate and to pursue your passion. And you get an opportunity to ask questions. What I find most helpful during these master classes is really getting that personalized attention from the coaches. And your coaches are Dr. Brittany and Dr. Leisha, and we are super excited. You might be thinking that, oh, it doesn't work for my schedule. We encourage you to sign up anyways, because we will be sending out the replays, and that way you can consume the content on your own time. And we will have a follow-up session all about Q&A. So come with your questions and get answers.
That's exactly right. So they are Tuesday, November 12th at 8 p.m. and Thursday, November 14th at 8 p.m. Eastern Standard Time. You can click the link in our show notes to register. It is free, and we cannot wait to see you there. All right, Alicia. Well, I see that you are in a different setting, and I know that you're in Phoenix, which I've only been to Phoenix once. So what's going on in your life? Why are you in Phoenix? Give us the tea.
Yeah, so I am here for the Family Medicine Conference. Each year, the American Academy of Family Physicians has a few major conferences. I was just at the national conference in Kansas City in August, and that conference is mainly for med students and residents. I was giving a workshop there on finances, and so that's why I was at that conference. That is also the conference that a lot of residency programs will go to recruit new trainees. But this conference here in Phoenix is more for the attendings. And it is usually like a week long. So I'll be here for the week. And they have all these updates on all of these different guidelines from all of the things that you can imagine. And so, yeah, that's why I'm here. I don't do a ton of primary care, but I still do some, from the patients that I see at the urgent care to the patients that I see in student health to me precepting the family medicine residents. And so I was like, man, I need to stay abreast of new knowledge and things, because sometimes when I'm precepting the residents, I like give them guidance and they'll be like, oh, Dr. Taylor, have you considered this medicine? And I'm like, wait, what? I was like, okay, let me go to this conference, help myself out. Also, I went to this session yesterday and it was like updates on billing and coding. And I definitely wanted to go to that one because I was like, I don't do a lot of family medicine where I'm like billing on my own, but my residents do, obviously. And so I want to make sure that they're billing correctly. And I don't know if I told you this before, but one of my really close friends does family medicine and she's on her second year out of practice. So the first year that she was in practice, she was on like this guaranteed salary, if you will. And then they had like a bonus structure in place. But this is the start of year two. And this year, they're basically taking whatever she would have made base salary plus bonuses and using 90% of that as her new base. And then the rest of that she'll get in bonuses. And so basically, whatever she billed and made last year kind of sets the tone for her base this year. And I remember her talking to me and she called me freaking out. Alicia, oh my gosh, I got to talk to you. And I was like, what? And she was like, it's about money. And I was like, I'm sure it is. What's going on? And she's like, something bad happened. I don't know what to do. I'm freaking out. I'm like, okay, all right, now's the time to let me know what's going on. And she's like, so they redid my compensation and you wouldn't believe what happened. And I'm like, what? And she was like, so I get $70,000 less than the physician that sits right next to me. And I was like, what? And she was like, we do the same work. We see the same amount of patients, but she gets paid so much more than I do. And I go, okay, all right, let's think about this logically. I was like, do you know why this happened? Is there a reason for this? And she goes, apparently I'm not billing correctly.
Mm,
And I go, what? And she goes, yes, I didn't realize I wasn't billing correctly. No one taught me this in residency.
wow.
And she was like, I was just billing these patients as 99213s and some 99214s, but apparently there are all these other codes that I'm supposed to be using and all these other things. And apparently I've just been underbilling. And because I've been underbilling, it set the tone for this new base. And she was like, I had no idea that I was underbilling because it was my first year out from residency. And so I was making so much more than I made as a resident. And I was still getting some bonus that I thought I was doing fine.
Mm-hmm.
And now I realize I'm not. And so she was just like, oh my gosh, I have to learn this. And so she sat down with her colleague. She's a lot better at the billing. And for her, even though the base is substantially lower than her colleague, whatever she gets above the base, she'll get as a bonus. And so instead of getting that as like a set salary each month or every 2 weeks, she'll end up getting that in her bonus structure. So it's not like she completely lost out on all of the money, but it was a very hard lesson for her to learn, in that billing and coding is extremely important. We need to get better at this and all of that stuff. And so hearing her story motivated me. Let me make sure I go to that billing and coding talk. And so I was in there with my phone out, when the lecture's good and you're like snapping photos on your phone and you're blowing things up. My friend was in there with her iPad circling and writing down notes and highlighting things. I mean, that talk was full. Let me tell you, they had to host a session multiple times. The room was packed. That's what I'm doing at the family medicine conference, trying to get my money right.
Well, I think that this is a good topic for us to talk about even on this podcast, because once we consider ourselves as not only just individuals, but part of this larger corporation, as larger business, then I think we start to shift our thinking and our practices. And it's always a little bit challenging for me because I didn't go into medicine just to make money. I mean, there's so many ways to make money. And I did not go into medicine for me to think about, how do I effectively bill and code this thing so that we can get the most money from the insurer? But I sit on the finance committee for the Department of Medicine, and I hear all of the time, okay, are we reaching our target? Are we not reaching our target? Like, what is the funds flow and all of this? And a lot of that goes back to how we're billing. And so at the Division of Hospital Medicine, we realized that our division was not reaching our target, what was projected for us to make. And a lot of that was because of billing. And we have our administrators who were going through and manually looking at every person's encounter if they had billed or not. And I was like, oh, what? You're doing this manually? So as a QI project, I kind of set up the system where they did these automatic pools. And we realized that we're missing out a lot of money. And that communicates to this larger entity like your friend, like, how productive are we? How much should we actually get as a payback before our efforts? And if they see that this division is not doing well, then why should we support that division with research funding, with other types of bonuses and things of that nature? It's a trickle down effect. You don't want to overbill. You just want to bill appropriately for the services that you provide. So recently, one of the things that I've done and changed my practice is when I'm having that long family conversation, if I'm going and spending more time than I would typically spend, I bill for that time. I bill for like a prolonged visit because that's time that I'm taking away from another patient. That's time that I'm taking away from other tasks that I need to do. And it still has a value to it. Like our time has a value. So I'm so happy that your friend learned the lesson. I hope that her salary increases significantly and that more so that her boss and the institution starts to see the actual value that she's providing. And I think that's one of the ways that we communicate that.
Yeah, absolutely. I think for her, it was a big deal because she sees patients 5 days a week. Like in family medicine, there's different practice models in clinical hours or patient facing hours. And some jobs you're considered full time if you have 32 patient facing hours, which is only 4 days a week. And some jobs it's 36, which is 4.5 days a week, with the other half day or the day being admin time. But for her, when she was first starting off, she saw patients like 20 patients a day, 5 days a week. And she really wanted to cut back to 4.5 days or 4 days, but she wanted to maintain her salary. And so just knowing, oh, wow, if I learn how to bill appropriately, right? Not overbilling, but billing
Mhm,
appropriately, then that allows me the income that I need to be able to cut back and have more of a life, right? It also ensures
mhm.
that my staff is compensated well. Sometimes in medicine, we get so discombobulated when there's a lot of turnover in the support staff. And it's like, okay, well, if we want to invest in retention, we got to pay our support staff more. And if we're paying our support staff more, then we need to make sure that we have revenue coming into the clinic, right?
Mhm.
And like you said, when you're in an academic institution, when the big wigs at the top are making the decisions on how much funding goes to which department, who gets research dollars, who gets the opportunity to go to conferences, CME money, all of these things, how much you're billing, how much you're producing factors into that. And so just knowing, wow, it's not that I have to work harder. I just have to make sure that I'm billing appropriately and that can drastically change my income and my quality of life. And so that was a big lesson for her and a big eye opener for me and saying, all right, well, I do sports medicine, but I'm sure this is relevant to me as well. So let me make sure I sit on this thing too. So it was great. It was great.
Yeah. Well, that's a healthcare hustle for all of our
Yeah.
listeners. And sometimes, if there's not already a practice of doing audits, maybe you can go back and ask your employer, hey, when you did this billing audits, how did my bills compare to what the coders or the billers were actually coding? At least we have like a separate entity that helps us to kind of review things. And that feedback helps you to understand how you should think about the patients that you're serving and how you should bill appropriately for those patients.
All right. So enough about me. What's going on in your world over there in Boston?
Just kindergarten and soccer practice and piano lessons and swim lessons. Leisha, I'm just thinking, like, is all of this necessary at this age? Brooke, her days are full. She has piano on Tuesday, swim on Wednesday, soccer on Saturday, and then dance on Saturday. And I'm like, I don't know. I didn't do all of this stuff. Is this for me? Is this for her? I'm still trying to figure it out. And I think we'll probably keep going down this path of having our kids more active and trying to expose them to different things. So this year she wanted to do hip hop. So like, okay, in the past year, she's done creative expression. So anywho, that's what's going on, trying to keep everything organized in this household. And it is a decent amount of work. I can tell you that.
It sounds like a lot of work. I remember being in high school and my mom driving me to like step practice or dance practice and track practice and all these other things and like church group, Bible study, and like all of these things. I mean, she was basically like my Uber driver before there was an Uber driver, only I couldn't pay her. And I remember her being worn out. My mom was a teacher. And so she actually got off at a decent time. But it was like from the moment she got off work and her day ended, she was basically hightailing me and my friends to all of these different practices. It was a lot. And I'm like, oh my goodness, that is literally what you're doing. It sounds like a lot.
Yeah. And it's only going to get worse as they get older. But, I think it helps me to foster their skills and also their talents and what their interests are. So we will see how this all develops, but it is a little fatiguing for sure.
You know, only imagine, I'll tell you this quick story. I have two older brothers. When I was little, I always tell my dad this. I feel like he was like sexist and didn't know it. Like he was in denial because He put my brothers in all of these activities, all these sports. They played every sport under the sun. And I was not in anything. I was not in dance. I was not in step. I didn't take piano lessons, nothing. Every time I give chats, I remind him that he did all those things for my brothers and nothing for me. So you know what I did? As soon as I got of age, like in middle school, where I had the opportunity to volunteer for things, I signed up for every single activity, every single club. I remember I was in like the Sunshine Math Club. I was on the track team, the basketball team. I was on the art team. I can't even draw. And all of these things, every single group at church, they said, "You want to do it?" I said, "Absolutely." Because I'm not going to be on the sidelines watching my brothers all the time anymore. I'm going to be actively participating. And that was my story. So I'm glad that you're putting your kids and stuff. I know it's busy, but the little girl inside of me goes, yes, yes, finally.
Yeah, that's so interesting also because I find that there's a discrepancy with the amount of activities that Brooke is currently in and that KJ is in. And KJ's younger. So at some point he will become more active. But I think maybe because you were the younger or
Yeah,
youngest,
yeah, yeah.
that not to say that they forgot about you, but
It's so many things. I'll tell you another story. I asked my mom about breastfeeding because my sister-in-law is breastfeeding. And I go,
mm,
"Mom, was I breastfed?" And she goes, "No." And she said it with such pride. And I said, "Mom, do you know how much smarter I could be? These immunoglobulins in the breast milk, I could have a better immune system. I could be smarter, like all these benefits of breastfeeding." And you know what she told me? She said, "You know what? I breastfed your brothers, but when I got to you, I was tired." And I said, "How dare he just admit that to me?" She goes, "Look, I was tired. Breastfeeding's hard. It was a lot. And I just said I couldn't do it. Not any sports. I didn't get breastfed."
and you still turned out okay. I'm like, okay, as a parent, I'm doing better than my mom. Listen. And then I went to public schools in Flint, Michigan, and I turned out quite all right. So my kids will be fine.
You did. You did.
As physicians, one of the most important things that we can do is make sure that we secure our income because a lot of our financial plans are contingent on our high doctor income. One of the things that you will need to do is make sure that you get long-term disability insurance.
Now, Pradeep and his team at PKA Insurance Group have a reputation for putting people over profits and always doing what's best. Do not hesitate to email PKA Insurance and his team today.
They will help you get the insurance you need with the service you deserve.
So now let's move on to our financial focus, which is talking about making the most of our benefits. To introduce this topic, I actually want to admit that one year I missed open enrollment. That means we didn't have any health care. I had no 457B. Well, kind of turn that on a little bit later, but we had no disability. Well, I didn't have any disability insurance. My husband had his. And I'm like, what? How did I miss this? Like, there are on the screensavers at work, like, hey, open enrollment emails were being sent out and I didn't enroll in nothing. And it really, one, it gave me a lot of anxiety because when I realized it, it was a week after open enrollment had closed. I'm like, wow. And then it just helped me to think about, okay, what is going on in my life right now that I missed something that's so critical for our health and our safety? And one of the things is just thinking about the systems in place. So not only like environmental, but what systems do I have in place that helps me to manage life? I had to change the way that I managed my emails after that because before I had all these boxes and filters and all of that, and somehow it got filtered in the wrong box that I did not check. So I took all the filters off and I said, okay, every day I'm just going to spend 15 minutes in the morning and 15 minutes at night going through the emails and trying to delete things. Now, people, I still have about 5,000 emails in my inbox. Your girl is not perfect with doing this. I've missed fewer emails. There's just an abundance of emails that are sent every day about staffing changes and patients and things of that nature that I just missed it. And I also thought that I had more time than I actually had. So this is my advice to you, unsolicited. Prioritize the things that are most important for your finances, your health, and your safety, and do those. Just allocate the time and get it done. And when you do, then that is off your list and you can go on focusing on other areas of your life. But prioritize the most important things. And we want to help you do that during this episode.
Yeah, absolutely. For those who may be like, what is Brittany talking about? So if you are new to attending HUD, right, and all you know is residency, newsflash, there is something at each job called open enrollment, and it is around this time of the year. Some jobs have open enrollment starting in mid to late October. Other jobs don't start it until November. But the point of the matter is that open enrollment is a period at the end of the year in which you select and enroll in all of the benefits that you desire for the next year, because you can't do this at any time of the year. It's not like you can just say, oh, I need health insurance, I'll just get it in January. Like, it's not available then from your job. You have to enroll in some of these benefits during a certain time period of the year, and only special circumstances will allow you to change that. And so this is the time where you select your benefits, you do all of your things and all of that stuff. And it happens, like we said, at the end of the year. And so there are certain benefits that you want to make sure are checked or are enrolled. And if you're like, Leisha, I didn't switch jobs, I'm at the same job. Well, it depends on how your job does it. I know at my job, things that you selected last year, some of them will automatically roll over, and others you have to actively select each year. And so people who had been at my job for 20 or 30 years, because some of the things auto-enrolled, they never really paid attention to open enrollment. But when our job switched systems, they blasted email. Hey, everybody has to reselect everything. If you don't select everything, you're going to lose coverage. I remember some of my, shall we say, older colleagues who aren't as tech savvy, they were like, look, Lisa, I don't know how to do this system. I'm scared. I'm not going to have health insurance next year. We had to have our HR people go into them, help them click the right buttons that go to the right system. So I'm saying this to say that even if you are not transitioning jobs, you want to make sure that you pay attention to open enrollment, because only certain things may roll over. You may have to actively select benefits. And we do not want you to miss out on some of the benefits that could be helpful to you.
Yeah, love that. Okay, so let's jump into the first thing that you should be thinking about during your open enrollment, and that is retirement contributions. And this is really important because you want to make sure that you are maximizing your employer match. And before actually we start about retirement contributions, I just want to put a plug out to everyone that your HR should send out a guide of your benefits for the upcoming year. And I don't always do this, but I think it's really important for us to review that guide because it will alert you to any changes in like insurance plans, employer matches, and other benefits that may be accessible to you or no longer available to you. And so I think it's just really healthy. I know it's like 28 pages. It's a long document, right? It's a long document, but I think it is time worth spending just so that you are informed on what you need to do when you're enrolling in your benefits. And so one of those things that you need to think about is your retirement contributions and your employer match. We encourage all high income earners as best as you can to contribute the maximum to your 401k, your 403b. However, you want to make sure that it aligns with your goals. And this is an opportunity for you to take it out to reevaluate what those goals are, reevaluate how much you put into your 401k or whatever type of employer sponsor retirement plan that you have, and reevaluate what is the employer match. Is there an opportunity to get more match if I did not max out this account and I did not receive the full match? And if I did not max it out, is there an opportunity to contribute more? You also want to think about how the money is being distributed. And so is it going to be that you want to make all pre-tax contributions in a traditional 401k, meaning that that money is going to not be taxed now, but when you pull it out at the time of retirement, it will be taxed? Or do you want to make a contribution to a Roth 401k, meaning that the money is taxed today, but when you pull it out later during retirement, it is not taxed? And so going through some of those calculations of one, reflecting on how much you did, what you did, and how that felt, thinking about your tax situation and what should that distribution look like. And then also, are there other opportunities to maximize your employer match and take advantage of that?
Yeah, I love all of those things. I think those are great tips. Another thing to maybe look into are vesting periods. And so what that means is a lot of jobs will give you a match, right? That's free extra money to incentivize you to contribute to the 401k or to the 403b. But there may be a certain time frame in which you have to work for the employer before you get to keep the money that they matched. And this is really important because if you were somebody who is thinking about transitioning jobs, let's say you're working at your current employer now, but you know in a year you're going to move somewhere or you're getting another job offer, you want to make sure that you take a look at the vesting period. When do you actually get to keep the money that your job matched you with? A lot of jobs make it so you have to be there for at least 2 years or 3 years or something like that. Some of them have a sliding scale. And so pay attention to the vesting period when you are putting in your retirement contributions and choosing whether or not you want pre-tax versus Roth. Another thing that I always like to encourage encourage people to do when it comes to retirement is to select how they want the money to be invested. A lot of jobs nowadays will have a default investing option where your money is automatically invested in for the more popular index funds through something called a target date retirement fund. But that is not the case everywhere. Some jobs, if you don't select how you want the money in your retirement account to be invested, it is just sitting there in a savings account. And so you want to ask your job, hey, is there a default investing option? What happens to the money in this account? How is it being invested so it's not just sitting there? So looking into the vesting periods, making sure that you have selected or are at least aware of how that money is being invested. I also want to encourage you to make sure that you know how to look at the money in your retirement account. You know, it's so funny. I was at the urgent care. I was there with another physician. So we are like getting to know each other. It's my first time meeting her there. And I say, hey, I don't think we met. And she tells me her name. And she says, my husband just started training at Emory. He's in fellowship and I haven't started my official job yet. And so I'm working at the urgent care. And I go, well, what's your specialty? And she goes, family medicine. I go, me too. And then we're talking about like where we went to training and we end up bonding over the fact that we both went to Duke. And I was like, oh, you're a Dookie. I'm a Dookie. Oh my gosh. We both went to Duke. It's the best school in the world.
Wait. I'm sorry. Why do you all call yourselves Dookies? That sounds so bad.
And our mascot is the Blue Devils and I'm Christian. It's the whole thing. But anyway, you know what? It is what it is. We're just going to roll with it. Okay. We're just going to roll with it. So I end up finding out this stuff about her because I'm like nosy at baseline. And I find out that she did her family medicine training in California. And I go, which school in California? Girl, I did fellowship in California. And she says that she went to UCSF, so University of California, San Francisco. And somehow, some way, we got on the topic of money because that's just the kind of person I am. And I ended up telling her that one of the things that I missed when I was in training in California is California has something called the DC Safe Harbor. And what that is that when you work for a public institution and you are in training, so you're not a student, but you're not an attending yet, so you're in training, you're in residency or fellowship, you don't actually have to pay Social Security taxes. What happens is they take the money from the Social Security tax that you would have paid and they actually invest it on your behalf. And it's in an account that is very similar to a retirement account. And so I was telling her this, right? I was like, oh, you probably have access to this DC Safe Harbor. And she looks at me and she goes, Leisha, I don't know anything about finances and I don't know what you're talking about. And I go, how they took the money out of your check and they invested it on your behalf. And she looks at me and she goes, they took money out of my check? I have money invested? And I go, girl, you probably have like $30,000. And she goes, I do? How do I get it? And I said, well, because you went to University of California in San Francisco and all the UCal schools are under the same system, I was like, well, it's probably housed at Fidelity, which is a brokerage firm. And she goes, I don't know what Fidelity is. I think I've heard of it. And I'll go, girl, walk in, make an account. You will get your money. And she's like floored, but also very excited at the thought of having $30,000 that she didn't know existed. I'm telling you this story to say a few things. Number one, make sure that you know how to access the money in your retirement accounts because a lot of places auto enroll you. And so even if you didn't select how you wanted the money to be taken out or invested, you probably had access to it. Number two, know the vendor or the brokerage firm where it is housed. If you work for, I don't know, Harvard, for example, right? Who is the vendor for Harvard? Is it Fidelity? Is it Vanguard? Is it Charles Schwab? Like what investment brokerage firm houses the money? You should be able to log in and see what that is. And for her, she was so excited. She didn't know the vendor, but because we both worked at UCal schools, I was able to help her out. And so I remember her calling on shift. I said, go and take a break and get your money. I'll hold down the fort. I really want you to get your money. So she goes in the break room and she's calling Fidelity and she's like, I think I have money. They're asking me to verify all these things and she's so excited. So anyway, make sure to know where your money is staying housed, who the vendor is, how to access the money did you need it. And so that's my plug there. If you are self-employed or you do locums work or you make money on the side, maybe you have a W-2 job, maybe you're employed somewhere, but you also make some extra money on the side. Don't forget that you can also open a solo 401k. So this is my plug for all the folks out there that have retirement account. Know when the money is vested and when you can keep the matching money. Make sure that you maybe alter your retirement contribution so that you can contribute the maximum each year, keeping in mind that it may go up each year with inflation, knowing how to access the money, those sorts of things.
Yeah, that's fantastic. And thank you for sharing that story. I know she's so happy. And this is why it's so important for us to just have conversations about money, because it's those little changes that raise our awareness. And I feel as if the universe matches us. Now you've introduced her to Fidelity, you've introduced her to employer matches and all of these other things. And now you've sparked this fire, right? It's a little ember. And then I'm sure she's now going to start to read more and learn more. And so you should check in with her to see how she's doing.
but I'm glad she got the money that she was unaware of. And the vesting periods is also a critical piece. I think it's a critical piece to consider because you want to understand, is this a good time for me to actually contribute to my employer 401k? We know that taxes is going to be the highest expense that we're going to have as a high income earner. And so I think even without a match, it could still be beneficial. But if you're going to lose that match, you might want to differ how you're investing. You might want to try to maximize other accounts and think a little bit more strategically about how you're going to save for retirement. When I was at Emory, actually, I left before the vesting period was completed. So I lost part of my match. And it was something that I'm not very happy about, of course, but
That deep breath. You're like Kate and Kevin. You're like, my husband had to go to fellowship in a different city.
I could have made it work. I could have traveled back and forth because we have family in Atlanta and how I work as a hospitalist. I could have done a bulk of shifts, have family to support me or take the baby. But I was pregnant when we decided to move to Boston. And I'm like, I don't want to be a single parent. This is going to be hard enough. And so I lost out on a lot of my employer match, but that's neither here nor there. You make up the difference and you have to understand just how it's going to impact you. And this is not a decision that I made per se because I'm married. You got to roll with the punches and make sure you make decisions for the unit as a whole. But if I knew that I was going to be transitioning and that I wouldn't get that match, maybe I would have thought differently about how I invested that money. Maybe I wouldn't have, because putting that money away and that is pre-tax, it still could have worked out in my favor. But all of that to say is that these are some of the minor things that we think about that are minor, but can have dramatic impact in your financial decisions. All right. So now let's talk about health insurance plans. And this is kind of where, when I missed open enrollment that year, it raised a huge flag, not only just because I want to have health insurance. We could have gotten some health insurance through my husband's employer because I don't think his open enrollment had closed at that time, but also that the type of health insurance plan that I would have elected for means that I could or could not invest in another type of account. That was really important. So when you're thinking about your health insurance plans, at least for me, and I know this differs between the two of us, I think, Leisha, that I am enrolled in a high deductible health plan because it gives me access to the health savings account, which I use that money to invest. And we can probably do a whole episode about health savings accounts. But basically, it's pre-tax money that you can put away for designated healthcare expenses. And instead of using it for healthcare expenses, you can invest that money. So it's pre-tax contributions into an account that you can use to invest and not use it for healthcare expenses now, but use it for healthcare expenses later during retirement, or if something were to happen and you have an illness, God forbid, and you have higher healthcare costs later. So this is something that I wanted to make sure that we had access to, this high deductible health plan. And it's only offered with my employer opposed to my husband's employer. And I thought I was going to miss that opportunity, but thankfully we were able to figure it out. So when you think about a high deductible health plan, it has some benefits and also some drawbacks. Some of the benefits is that there are lower premiums. So that means on a month-to-month basis, what I pay for this plan and what my employer pays is going to be lower than a traditional, a non-high deductible healthcare plan or a traditional plan. But on the flip side of that, although you might pay lower premiums from a month to month, it can be more costly because you're going to have a larger expense that you will have to pay until you reach your deductible. And so that's some of that calculations there, and thinking about, is this plan going to actually work for me? Is that cost benefit analysis actually going to be in my benefit today and in the long term? And so for me, the reason why I elected for it is that my employer actually makes a contribution to our HSA. I can put that money away. That's free money that I can put away and invest, right? And then I can put additional pre-tax dollars away that helps to reduce our taxable income and invest that money. And we're not a sick family. We are pretty healthy. Like, we go to our annual visits, except I haven't done mine this year. So I should probably schedule an appointment.
I can't even be mad at you because I haven't done mine either, because I am a PCP, and I've ended up talking to my colleagues. I'm like, hey, can you order this thing for me? And they're like, Leisha, seriously? I'm like, look, can we make this a judgment-free zone?
Okay, I feel like I am in community here, right? I feel seen. Thank you. It's something about having an objective perspective. So I still need to go. But I just had my life insurance exam. So, like, I've had blood work, I had my blood pressure and my weight check. I can listen to my own heart and lungs. But anywho, so we're a healthy family. So for us in my calculation, the healthcare expenses were not going to be as high. And so that's why we enrolled in this high deductible healthcare plan. What about you, Leisha? Can you tell us about how you make this decision on which plan to enroll in?
Yeah. So my job, there are three health insurance options. And I'm sure at most jobs, there's usually at least two, if not three or more different health insurance options. And so open enrollment each year as it's coming up for me, I will usually look at the benefits guide and look at the health insurance options because the plans might have changed, right? The insurance carriers might have changed. They may have altered some of the benefits that they offer. And so, yeah, I'm looking through the benefits guide and I'm saying, okay, we still have three options. Let me see what the cost of each of these are. So, how much is going to be taken out of my check every 2 weeks to pay for this health insurance, right? So, looking at the cost of all three plans, then I look at the deductible. What is the out of pocket maximum? Okay, in plan A, for example, my out of pocket max is $2,000 for an individual and $4,000 for a family. And plan B, out of pocket is $3,000 for an individual and $6,000 for a family. Health insurance C, it's 5,000 for an individual and 10,000 for a family, right? So I'm saying, ooh, all right, let me look and see how much I might spend out of pocket. Like, what's the max amount of money I might spend out of pocket? Then one of the things that I look at is copays, right? I go to see my primary care doctor. If I go see a specialist, how much does that cost me? If I go to the urgent care, how much does that cost me? If I end up in the emergency room, how much does that cost me? And these are the things that's going through my mind. Just like you, I'm a pretty healthy person. I don't have any medical diagnoses or issues or anything, at least that I'm aware of. We all heard about how I don't go to the doctor that often, but as far as I can tell, pretty healthy. I don't take any prescription medicines or anything. And I don't really go to the doctor, as we just discovered. And so I'm like, well, I don't really need a super comprehensive plan with all of this coverage because I'm not sure I'm going to utilize it. But one thing about me is I'm a little risk averse, Brittany. And so I say, well, what if I do get sick? How much would this emergency visit cost me? What if I do want to go to the specialist? What if I want to see the dermatologist or see the OBGYN or whatever it is? How much is that going to cost me? And so I'm making that decision. And one of the things that I was aware of is this whole high deductible health plan, right? If you're healthy, if you don't utilize a lot of healthcare, then maybe it makes sense to choose the plan with the highest out of pocket max, knowing that I'm probably not going to reach that because I don't utilize a lot of healthcare, and then have the ability to open and invest money in a health savings account. So if I enroll in a high deductible health plan, then the ability to invest money in an HSA account is open to me, and that account is very valuable. And so each year I enter open enrollment with that frame of mind. I'm going to see if the high deductible health plan makes sense for me this year. And the reasons I have not selected it in the past is because at my job, the high deductible health plan sucked. It sucked a lot. It was like, hey, if you go see any doctor for any reason, you're going to pay the full cost of that doctor's visit. And I have had several instances where I've looked at the full cost of seeing a doctor and it's been $500, $700 or whatever without insurance kicking in or whatever. And I'm like, ooh, I know myself. If I have to pay $500 for a doctor's visit, I'm probably not going to go. It's not that I don't have the money. It's that I'm pretty frugal like that. If I have to pay out of pocket for every single test that is ordered on my behalf, I'm going to start asking the doctor, how much is that CBC? How much is that CMP? How much is this test? If I have to pay out of pocket for any x-ray or MRI I might need, I'm going to ask them the cost and I'm going to try to save money where I can. And I just knew that about myself. And I said, you know what? I don't want that burden of knowing that I have to pay hundreds of thousands of dollars out of pocket if I see a doctor and that it's going to cost me that much. Another thing that I thought about is, am I going to freeze my eggs again? Am I going to do any fertility treatments or anything like that? I've been pretty transparent in that I've frozen my eggs in the past, and that is not necessarily a free thing, but just thinking about, am I going to be in a situation where I'm going to utilize healthcare? I'm not planning to have a child next year because I'm of childbearing age. That's always something that I think about. Is this the year that I'm going to get pregnant or something like that? And if the answer is yes, then I wouldn't choose that high deductible. I want the most comprehensive plan because I want to limit labor and delivery costs, whatever. You know, I have a lot of friends that just had babies and they tell me, Risha, I paid $5,000 when I had my child, or I paid X amount of dollars. And so this is my plug of saying, if you're like me and you're pretty frugal and you don't like having to pay the full cost for every doctor's visit until you hit some high maximum, if you're planning on freezing your eggs or doing anything that's utilizing a lot of healthcare expenses, then maybe it makes sense to choose a more comprehensive plan instead of the high deductible plan. So those are some of the things that kind of goes through my mind. I'm looking at costs, I'm looking at out-of-pocket max, I'm looking at copays, I'm looking at other benefits that certain health insurance plans may offer. Maybe maybe plan A says that they offer $20,000 in fertility benefits, something like that. So these are things that I'm looking at, or some of these other perks and nuances of the health insurance plans. But that's sort of what goes through my mind each year.
Yeah. Alicia, I want to say thank you for being transparent about that, about how this will actually play into your utilization of healthcare. Because I think oftentimes as providers, at least for me as a hospitalist, I did not think about how much does it cost if I order this CBC? How much does it cost if I order this X-ray? And what is like the pre-test versus post-test probability of like this test helping me in my decision making? Now, because I wear QI hat and I also talk about money, I think about high value care. And so the two factors that are considered in high value care is what is going to be the cost and then what is the benefit to the patient. And so I can hear you saying like, you're going to be appraising what is the benefit to me of this said thing and should I go or should I not? And I don't want anybody to avoid the healthcare system just because of cost. Your health and your safety is the most important thing, right? So you want to make financial decisions that will help you to accomplish that goal of maintaining your health and safety. And I also think that this is a moment to pause for planning. As you were talking, I'm like, you know what? I should schedule my cleanings right before open enrollment. So then if the doctor sees a cavity, I'm like, postpone that until next year. And I'm going to put more money in my limited FSA. I have not gotten an eye exam this year. I need to get one to update my prescription, but I'm thinking that I'm going to update it towards the end of the year so that I can use the limited FSA for vision and new contacts and getting new glasses and things of that nature. So if you have gone for something and the doctor's like, you need this procedure, and it's not an emergent thing that you have to get today, you can postpone it 3 months until the next year, what have you. These are some of the calculations. If you need any type of dental work and it's not bothering you too much, then these are some of the calculations that you could build into your open enrollment elections so that you can make sure that it works for you on the back end.
Yeah, Brittany, I have a quick question for you. How do you do things as someone who's married with children? Do the kids go on your health insurance plan, on your husband? How do you make that decision? Because I know during open enrollment is when you have to kind of decide if you have any dependent that you're also paying for.
So we just do it all as a family. When we first moved here, I had no benefits because I hadn't started working yet. I took some time off before I started my first job. And so we enrolled as a family on my husband's plan because he had the benefits. Now, as a family, even my husband is under my insurance, my employer, because I have access to an HSA, and the entire family is with me. But we could split the difference. My husband typically does the dependent care FSA at his employer, and I do all of the healthcare stuff at my employer. But you have to figure out who has the best plan and what are going to be the benefits for that. But I usually don't split the family because it makes it a little bit more complicated. If he has a different insurance than I have, and I'm managing things or the kids have, then it just makes things more complicated.
Gotcha. Yeah. One of my friends just had a baby and we had this conversation, and she said that the baby went on her health insurance, and her husband had that conversation because I don't think her husband is allowed to be on her health insurance plan. I think some employers have a rule where if your significant other is offered health insurance at their job, then they have to enroll through their job. They can't just hop on our plan. So some employers have different stipulations about who can or cannot be added to a plan. Some allow for domestic partners, some do not. You have to look into the rules there. Wanted to clear something up. You mentioned about limited purpose FSAs and regular FSAs and HSAs and all those things. And there's letters and it's an alphabet soup. So HSA, health savings account, that account is only open for people who have a high deductible health plan. If you do not have a high deductible health insurance plan, as I do not have one, then we have what's called a comprehensive healthcare FSA, flexible spending account, open to us, where we can put pre-tax dollars into that account and then use that money for healthcare expenses if we need it. If you have a high deductible health plan that gives you access to that health savings account, you still have access to a limited purpose FSA, and that's an FSA that allows you to put pre-tax dollars that you can use for dental care and vision care and things like that. There's an HSA, like health savings account. There's a regular FSA. There's a limited purpose FSA. And then there's the dependent care FSA for childcare expenses. So it's like 3 kinds of FSAs and an HSA. And it's like, girl, I can't keep it all straight. So I just wanted to mention that because I know our listeners who may not live and breathe this stuff as we do may have some questions about it. So wanted to throw that out there.
Thank you for that clarification. Yeah, it does get confusing. And one of the things to note is that FSAs, the flexible spending account, is use it or lose it. So you don't want to overfund that account. You never want to overfund. So you want to be very thoughtful about how much money you put into the account so that you do not lose it. And actually, one year I almost lost some money, but I was like, you know what? I'm just going to buy some new contacts today. And that's how we made it work. So I just want to move on to one other critical piece of your benefits is your insurance. And oftentimes through your employer, there will be disability insurance, both short and long-term disability insurance, and also life insurance. So if you have not listened to our disability insurance and life insurance episodes with Pradeep Auto, you definitely want to go back to those episodes. We will leave them in the show notes so that you can learn some of the differences with disability insurance and life insurance. And Leisha, I benefited from that conversation so much as I'm just thinking about it now. Pradeep is amazing and he is a wealth of knowledge. So, Leisha, I have a question for you because we have our own occupation, long-term disability insurance. What do you typically do with your disability insurance through your employer?
Yeah. So at most employers, they offer some sort of long-term disability insurance coverage for free. And so I don't even think I have to select it. I think it's just like automatically given at my job, but I still have that. And Lord forbid I don't get disabled. But if that were to happen, then what would happen is I would collect from both. I would collect money from my job and I would collect money from my own occupation long-term disability insurance policy. The reason I have both is because usually the one at my job is not sufficient. Most jobs will give you like 60% of your salary up to a certain set salary limit. If you're a high income earner like a physician, right, they're not giving you 60% of $300,000 or $400,000 or whatever you make. Usually 60% up to like 200,000, and then that's it. And I know at my job, the long-term disability insurance doesn't kick in until 6 months versus my own individual policy. The long-term disability insurance kicks in at 3 months. And so they may have different dates in which you can start collecting on the money. There's different caps on the money. The long-term disability insurance at my job is pre-tax, meaning they're going to not only give me 60% of a certain limit, but then they are going to take taxes out of that check versus the long-term disability insurance that I have on my own, I get post-tax dollars. So they're not taking any taxes out. So there's different nuances in the disability insurance I have through my job versus the disability insurance I have on my own. I'm enrolled in both mainly because the one at my job is free. And then I need my own because it's more comprehensive and gives me better coverage. So I just have both.
Okay. All right. And what if it was not free? Sometimes people ask me, oh, should I get the extra long term disability insurance? Like, what if there was a cost to it? How would you reconcile if you should enroll in your employer's long term disability insurance policy when you have your own independent policy?
That's a great question. I think it would depend on the cost because there's only so much insurance coverage you can get. Like if you talk to an insurance broker, an insurance agent, and you tell them you want long-term disability insurance, they're going to ask you, how much free coverage do you already have available to you at your job? Because the insurance companies are not going to over-insure you. And so then if you're asking me this, like, hey, I have to pay for the one at my job. I obviously have to pay for my own. Which one should I pay for? The one on your own because it's more comprehensive and better, right? Unless you're getting some drastically cheaper deal for the one at your job. I don't like knowing that my insurance is tied to my job. So that means if I leave my job, then I'm like hung out to dry, for example. I like to know that no matter where I work or who I work for, I am covered. I like to know that my coverage is going to start on this date and it's going to be post-tax dollars. I'm going to have the money that I need. So I think for me, if it was not free at my job, I would just increase my own individual disability insurance policy and just have that one.
Yeah. I love that. Love that answer. I do the same thing. It's free. So I enroll, I get the benefit. If it no longer is free, I don't enroll for anything extra because I have my own independent policy, but then it's going to be a cost benefit analysis and try to figure out what actually works. And you're so right. I was trying to increase Kevin's benefit for his long-term disability insurance policy. And they said, well, what does he actually have at his employer?
Yeah.
Like, what disability benefit does he have? They did not allow us to increase, but we maintained the rider, the ability to increase in the future, and we'll see. But I'm always going to submit every single year to see if we can increase the disability insurance to make sure that it covers all of our expenses. And Brittany, one more thing that I think our audience should be aware of is the fact that their benefits may have changed. Usually it's during this open enrollment period where the HR department, the human resources department will notify people of different benefit changes from year to year. And I know for me at my job, this is really paramount. I've already actually spoken to human resources because that's the kind of person I am and asked them about upcoming changes. Currently at my job, ironically, there is no maternity or paternity leave policy. We have short-term disability that females can take out if they get pregnant and have a child, but we don't actually have an official family leave
leave policy or parental leave policy, and they are implementing that this upcoming year. And so they talked about how that's going to be a new change. They talked about how they're going to make some tweaks to our short-term disability insurance policy. They also mentioned how we're going to have some changes in our personal time off or our PTO policy, and that they're changing some of the holidays. They're adding additional vacation days, which is fantastic. They're changing some of the sick days. And so I'm letting our audience know about this because if these are some of the changes that I'm incurring at my job, then it's entirely possible that there may be similar changes for you at your job. When I used to work at other places, they had these law packages, right? And so during open enrollment each year, you could sign up for a law package. And usually it was like $15 or $20 a month. But it gave you access to lawyers. And so you could use those lawyers to set up a trust fund from your family or a living will or fight a traffic ticket or something like that. And so these law packages were available for us. And of course, you had to sign up for them during open enrollment period. Some of the places had college tuition assistance for the kids and even for yourself. So if you wanted to take a course during the next year, you could do so and they'd reimburse you for part of that cost. If your kids were going to college, you could get reimbursed for some of that cost. A couple of the places that I interviewed with in the past had mortgage assistance. So they actually gave you a percentage of the down payment of your home. And so these are some of the sort of non-traditional benefits that you may have to opt into each year. And of course, you do that during this time of open enrollment.
Wow. Thank you for sharing that. When we transitioned, I think I was more acutely aware of looking at some of the nuances of the benefit packages, particularly as you're talking about like mortgage down payment assistance and college assistance for children. I am aware of them, but some of those things are just so far off now. Because I remember that from when we moved here with my husband's employer, we actually reached out to them and it was like no longer available because he had been working for the institution for some time. So there's probably a little bit of nuance, but there's nothing wrong with being informed and asking, is this possible? The worst thing you can get is a no, and you already have a no if you don't ask. So I really love that, these are some of the changes. And girl, can't believe you've already emailed the HR department. So wait for them to send it out to everybody else. Like, Leisha got to be ahead of the game here, people. Well, okay. To my defense, I was asked to give a presentation to some of the GME staff, so the graduate medical education staff, the admin. And they wanted me to talk about some of the benefits at the organization because they get asked a lot of questions and I'm sort of the finance person. And so in preparation for that presentation, I contacted the human resources department to make sure that I was up to date on all the changes. And this is when they sort of divulged this information to me. So it was not that I was just impatient, although who knows, I probably would have contacted them anyway. But, it was actually in preparation of a presentation. So I had a good reason. And you know what? They love hearing from me. Now, maybe they just say that to me and they don't really feel that way. But I think I'm the only one that actually asks them these very detailed questions and like gives them new ideas. And so, yeah, I have a great relationship with the human resources. Well, I love that it's incorporated into your financial talk because I think oftentimes we overlook these benefits that we are working for. We're so good at generating an income and we think that the only thing that we gain is a salary, whatever is deposited into our paycheck. But really, when you're thinking about money, if you can minimize your expenses, use your benefits to offset other expenses that you will have to pay for, then why not? That is something that you're working for as well. And let me tell you, your employer is thinking about it. It's called your imputed income. That may not come into your salary, but whenever I'm reviewing my salary sheets, I always see that imputed income. I'm like, oh, okay, this is a summary of all my benefits and everything else they're giving me that I may or may not be taking advantage of. So take it from this episode and do your due diligence. Maybe you want to be like Leisha and reach out to them ahead of time to see what are some of the changes so that you can use that to prepare for the upcoming year. All right. So now it is time for fun money. Leisha, I have not been spending much money on myself, but I do have a fun money to share with you. So I'd love to get your take on it because I know that you are also pretty frugal like me and how you had to call everybody and their mama at 2:00 in the morning in order for you to buy your designer bag. So I am not buying bags, but I am buying, I guess, a designer bikes for my children. Like, oh my gosh, a bike for KJ, Leisha. The brand is Zoom. They're not sponsoring this podcast, but if you want my kids, they are very photogenic. A Zoom bike for KJ, my youngest Kevin Jr., was $370 for a little bitty, like 14-inch frame bike. And it took me a whole week in order to buy this bike. I was looking on Marketplace to see if somebody was going to sell it at a discount. I spent it. I purchased a $400 bike for KJ, and Brooke has a $300 bike. I'm like, really? $700 for bikes that you all are going to grow out of? I don't know. They're having a lot of fun, but I'm still just like really processing the amount that I spent on bikes for my children.
So, okay, hold on. A moment of transparency. I thought you were going to say 3,000.
Oh,
So my perspective is a little warped. One, because I have not bought children's bikes. Your son KJ is what, 2 or 3, right?
he's 3.
He's 3. And then your daughter is what, 6?
Mm-hmm.
Okay, so 3 and 6. Okay. I have not bought bikes for a 3-year-old or a 6-year-old in full transparency. However, I am a sports medicine physician. I promise you I have a point. I'm a sports medicine physician and I cover a lot of events. When I was living out in LA, one of the events that I would cover is like the Ironman, right? So this is people like running a certain amount, swimming a certain amount, and biking a certain amount. And I was floored when I found out how much people paid for race bikes. Brittany, would you believe that people are paying $10,000 or more for a race bike? I thought that was insane. And so this is the vantage point that I'm coming from. Obviously, you're not buying your 3-year-old and your 6-year-old race bikes. But when you said, Leash, you won't believe how much money I spent on a bike. I'm thinking, well, my vantage point from LA is like people are spending thousands of dollars on bikes, which I think is ridiculous. So when you said 300, I'm like, Brittany, isn't that like the normal cost of a toddler bike? Like, I don't know. I have not bought toddler bikes, but I can remember going to the store for my little cousins 10 years ago and the bikes were like $150. So I'm like, okay, with inflation, $300 sounds reasonable, but I don't know. Maybe they're normally $100. Help me understand.
Yeah, I think it really depends on the brand of the bike. You could definitely get a toddler bike for about $150. And for me, for most of the things for my children, I get as hand-me-downs. We have a beautiful community here where we basically just post it on Facebook, this Facebook group, and people say if they're interested or not. And so every single thing that I've gotten for them as far as like toys, and unless my mother-in-law or my mother purchases the item for them, I've got as a hand-me-down. So for me, I'm just like not accustomed to spending so much money on my children because I know how quickly they grow and they're not going to be able to use this bike for an extended period of time. So it's a little bit of a shock. You know, one of the reasons why I spent so much money is because Brooke wanted to really ride a bike. Her friends were riding and she would say, oh, why are all of my friends doing this? And so it's always kind of like that peer pressure. This bike has been touted to learn how to ride a bike in a day. And it's like customly designed for children so that they could ride with ease. She's riding circles. She's learning how to go up and down. I'm like, okay, when you go down, you got to brake because you can't go fast. There's gravity here. So she's learning a little bit of physics during this process. So it has worked to build her confidence. And so now she doesn't have that comparison and feeling like she's less than. Similarly, for KJ, this bike is touted to be like the first rider's bike. We took it out yesterday and put the pedals on, and we'll see. Hopefully he'll be riding in a few weeks or so by himself. But it's a decent amount of money to pay for a bike that they'll be in for 6 months to a year.
Gotcha. Well, I'm happy that your kids have really nice bikes. That is going to expedite their bike learning process. You got to send me some photos of them riding. It's funny. I know that you are a very frugal person, but sometimes it's very interesting, right? Because you and your husband make, let's just say, well above the national average in terms of income. And so to hear you be like, I get everything as hand-me-downs and I can't believe I spent $300 on a bike. I'm like, okay, I think they would enjoy a nice new bike and probably love the fact that they got something that wasn't a hand-me-down. And it's not like you and your husband couldn't afford it. So I recognize it's a shock, but I am happy for them that mommy got them something new. I bet they were so excited to get it.
Yeah, they were. Thank you. I have to reconcile that. Like, okay, we have the money in the bank, you know, all of our investments, retirement accounts are maxed out. We've taken care of our priorities. So why not give them something new? But usually I like to say, well, this is new to them. It does not have to be new. As long as it's functional and it's new to them, the excitement is still there. But I'm reconciling my emotions. But you know, once they're done with it, I'm putting it back on Marketplace on Facebook and I'm going to try to get some of my money back. I sell so many things on Marketplace. All right, that's for another episode. But
you know what? At some point, we should talk about your marketplace selling and how we could utilize that for credit card points and free travel. But I won't get into that right now. So you're buying bikes for your kids. I am actually trying to clean up my place and my environment. I would say that I am probably not the neatest person in the world. My messy tolerance, as I like to say, is very high. I am trying to change that. I think that when my environment is cleaner, I can function better. I can be more creative. I have a little less stress. And so I'm trying to make a conscientious effort to be cleaner. And I'm recognizing that I may have to outsource some of this. I'm really thinking about like hiring a maid because right now I don't have one. But this weekend I was like, how can I improve my space even more? So I started cleaning quite a bit. Not that it was super dirty, but I just wanted things to be neater and put away better. With that in mind, I also thought maybe I should decorate the place even more. I had already hung up some things, but this weekend I bought like a futon/couch thingy that I can put in my office so that if someone visits and they have like a place to sleep, there's a light that shines in to one of the bedrooms and it's pretty bright. And so I was like, maybe I should hang out some curtains, And I was like, man, I have some graduation stuff. I was like, maybe I should add a photo of me graduating and add some family photos. And so this is what I've been doing. I was spending my money on sprucing up the place, trying to be neater, creating a cleaner, happier environment.
Yeah, I love that for you. And honestly, Alicia, I wholeheartedly agree that when my environment is cleaner, it gives you a sense of relief. When I walk into a space and my messy tolerance is quite high as well, and I gotta declutter, it always is another to-do list. It's like open end or some energy leak to, oh, I gotta clean this up or I gotta put this away. And so if everything is nice and neat and tucked away, then it just gives me a moment of relaxation that I don't have anything else to do except for the thing that I came into the kitchen for. It's like cook a meal or make me a coffee or something else instead of having to put the dishes away and cook this meal and store this or what have you. So I wholeheartedly agree. And that is something that I'm striving to do as well. I think both you and I, we put a lot on our plate as far as to-do lists. Although I recognize the benefit, it's like, oh, I have these other things that I got to do first. So it's making the time to prioritize that. And I'm so happy that you did that for yourself.
Thank you. Thank you.
All right, people. So that is the end of this episode. And we want you to continue to stay wealth-minded. And we will see you in the next one. Hello, and thank you for listening to our podcast. And because of that, we have something for you, our Wealthy Minds Blueprint.
Have you ever thought to yourself, I wish I could be better with money? Do you want to start investing and saving for retirement, but keep delaying because you don't know where to start? Our Wealthy Minds Blueprint is here to help.
This guide will teach you what you didn't learn in your training so you can stop being confused about money and start taking what we call wealthy-minded action.
We'll help you become a master of your finances and simplify investing so you can get started today. Take control of your financial future by downloading your free copy of the Wealthy Minds Blueprint now and start building the wealth you deserve.
Hello, everybody. It's me, Brooke. I'm recording a little disclaimer for my mommy, Dr. Brittany Halford, and her friend, Dr. Lisa Taylor. Just so you know, they're not financial advisors, tax professionals, lawyers, or financial planners. Everything you hear is for education and entertainment. It's not strict financial advice, So use your best judgment, chat with a tax professional, and all those other people that you need to talk to. Thanks for tuning in today. Keep cruising on your journey to wealth and wellness. Bye-bye.
One of the most important things you can do is ensure you have long-term disability insurance. Long-term disability insurance secures your income if the unexpected happens and you are unable to work due to medical illness, chronic conditions, or an accident.
Unfortunately, all insurance agents aren't created equal. Some of them are so focused on making a sale that they fail to reveal certain necessary information, tell you about discounts available, or clearly explain the process. Pradeep Botto and his team at PKA Insurance Group are different. They have a reputation of putting people over profits and always doing what's best.
If you need life insurance or disability insurance, reach out to Pradeep and his team today. They will help you get the insurance you need with the service you deserve.